So when we look at this care plan, you see there are shapes on it and there are other patterns that we can tell. You see we have a circle here, we have a circle at this side, we have another circle here and another circle here. They are all corresponding. So this is the time that the problem was identified. This is the duration that was given in the objective that problem will be solved. And this is the time that we are evaluating. So you see, problem identified 5th February 2023 at 6:25 a.m. And you said the problem will be solved in 4 hours. So you go with the evaluation will be 4 hours plus the time of identifying the problem, which is 5th February 2023, 10:25 a.m. So then we have another thing to look at. You have this shape, a rectangle. This is the objective, this is the outcome criteria. So we say that when the goal is achieved, it will be evidenced by client verbalizing that she can now breathe normally, nurse observing that client has respiratory values between 16 and 20 cycles per minute. So this is what we use to tell if goal is achieved. So this same shape is here. Here it is shorter, so it looks more like a square, not a rectangle. So here you see that goal fully met as client's respiratory rate is 18 cycles per minute. So we are using one of the criteria here to tell that the goal was achieved. So this and this are also corresponding. How you know the goal was achieved should be part of how you were supposed to know. Thank you. So we see some things here, we see some parts are bolded. We have related to, have as evidence by clients verbalizing, nurse observing. These bolding parts, just bolding, are usually words that we don't change them. So if it is goal fully met, you can't go and say objective has been achieved. In the care plan language, for now, this is what we are using. I don't know why, but then we don't change it. These ones that I'm pointing at, this can be changed as patient says that, or as nurse identifies, but always you should be two. We should have one that patient will say, which is subjective, and we should have one that the nurse will observe, which should be objective. So that is how we are able to tell that the goal is fully met. And we can see other things here. We can see bolded and underlined. So you see, these are nursing orders. I earlier said that nursing orders should be straightforward. Losing tight clothes. So tight clothes around clients. So you see, it is a past tense of this. This tells us that we have done this. But here we are saying how it is done, or why it is done, or both. Around client's neck, blah blah blah, losing for free movement of chest. Let's see another example. Your prop client up in bed. Client was placed in a farless position to aid breathing. So you see, always you add more words to what is here, and then it's also a past tense because we only write intervention after the order has been carried out. That is why now you know how you did it and you have to add it. Thank you. So now let's come to another thing. This is just underline. That is what adds more words to the order. That should give you the full mark. Yeah, I mentioned earlier that it should be straightforward and you should have at least 4. Out of the 4, at least 2 of them should be the examinable tasks. So when you see this, I don't think we have a task yet in NMC Ghana on dressing patient. I've not met a task yet in RGN or basic nursing on opening windows and doors, but there's a task that covers positioning of patient. That is bed making, where you can prop patient up in bed. There's a task on administration of oxygen advanced nursing. There's a task in checking of respiration, which is vital signs. There's a task for administration of medication. Yes. So examinable tasks are the ones that has been bolded and underlined. This is another example, but this one without the shapes in it. So I just wrote, I noticed a mistake here and I corrected it. So this is time and date problem was identified. This is patient had high body temperature as a problem. And we know it's high body temperature because we know the value. If you don't know the value, you can say that patient is warm to touch. So that one, but the nursing diagnosis is still hyperthermia related to microbial presence in the blood. This related to factor is necessary, very necessary, and is the reason we have to fill the front page well. That's why I said in filling the front page, you don't forget to fill the medical diagnosis, because this will help us identify the correct related to factor. And this is the objectives to outcome criteria that the nurse said patient will have at the end of the care. And these are the nursing orders. So you see here we can have examinable tasks here, and they should be 4 or more. And these are the nursing interventions, which have more words than the nursing orders. And this is the time for evaluation, this is the evaluative statement, and this is the nurse's signature. So the scores on the inside, for each problem we mark across like this, it should be 4 marks. And you're supposed to work on 3 problems, so 4 times 3 is 12. So the whole of the inside is 12 marks. And please note that the problems you identify at the assessment stage at the front page, when you are coming here, you have to prioritize. So if patient told you at the last minute that she has headache, pain should always be prioritized above, let's say, risk for deficient fluid volume. Are you okay? If you notice patient has difficulty in breathing, it will also be tackled first, because breathing is essential and it should be prioritized. So this one, we don't arrange it according to what was identified at the assessment phase. We arrange it according to priority.